Welcome, everyone. We're going to give it a couple seconds and let people get into the meeting. All right, we're going to get into it. Good afternoon, everyone, and welcome to Strengthening Early Childhood in Kansas monthly webinar for April 19th, 2023. My name is Julia Gruss. I am a research project specialist at the University of Kansas Center for Public Partnerships and Research, and I will be your webinar facilitator for the next few months while my colleague Erica is on leave. I am also joined by two other members of CPPR today, Sarah Gardner and Clayton Gerard. Sarah will be our presenter today, and Clayton will be posting relevant links and webinar information in the chat. So if you have any questions or comments, feel free to use the chat feature as Clayton will be monitoring throughout the presentation. So thank you everyone for being here, and we'll get started. A few general updates before we jump into our presentation today. Of course, don't forget about the monthly webinar schedule. We're really just driving this one home, keeping that schedule up there for you so you know exactly when these meetings are being held. Also, feel free to sign up for our All In for Kansas Kids weekly e-newsletter. You can do that by going on to the Kansas Children's Cabinet website. Clayton will be putting the links in the chat. So anything you see on your screen that is a link, it will be in the chat shortly after. Also, a reminder that National Provider Appreciation Day is on May 12th. We celebrate childcare workers on this day, including teachers, nannies, and caregivers. The day is meant to build awareness around the holiday, thank our childcare workers, and showcase their contributions to their communities. From a simple thank you and gifts to social media posts and hashtags, this holiday is definitely deserving of all of our attention. Today's presentation is going to be a demonstration of the Kansas Community Data Dashboard by Sarah Gardner. And then after that, we will have some early childhood systems updates. So I'm going to go ahead and pass it over to Sarah so she can let you know about the data dashboard.
Thank you, Julia. Ugh, there's me. I'm with KU CPPR, and I'm very excited to demo what is live on the All In for Kansas Kids website, which is a data dashboard to hopefully help you as a community leader access some key data indicators to help you tell a story about need in your community. Go to the next slide. So before I dive into the actual data dashboard, I wanted to call your attention to three other data sources. So we have been sharing these on the All In for Kansas Kids website, specifically on the communities page. There are 4 resources on that page, and I will show you that when I get to the demo part about where to find the information. But if you go to allinforkansaskids.org/communities, and you kind of scroll down to the right, you'll see information titled Research and Data, and you'll see links to these 4, or these 3, plus the one I will talk about today, resources. The first is the Childcare Kansas Childcare Data by County. It's a point in time count. I'm sure many of you have accessed it. If you haven't, I highly encourage you to do that. It's on the Childcare Aware of Kansas website, and it pulls from their data system that tells you what the childcare capacity versus demand is at that given day based on the data that they have from providers in that county. It's in a really nice format that you can share with elected officials, or you can share with community partners. The Kansas Health Matters has a very, very robust website. I know that our partners at KDHE have utilized this quite a bit to connect with communities on a whole slew of data sets and data indicators to help you better understand the different needs ranging from health to education and more about your community. So it's a health-related statistical data. There's local resources and tools to help you understand the various public health indicators in your community. And the final resource that we are sharing on that site is the KSDE Data Center, which obviously it's by KSDE, the Kansas State Department of Education, and they provide Kansas education reports, including where there are boundaries for the different school districts, children's nutrition and wellness, and some of the information about the school finance formula. So you can visit that and see all of those other data indicators. So you might be asking, why are we doing another data dashboard if we have that wonderful array of data resources available? And part of it is to tell a more concise, meaningful data story. What we like about the dashboard as a value add to those other resources is it takes a couple of different indicators and it packages them together along with some narrative that you can actually use to convey how these different indicators fit together to tell the story of the education and health and care situation in your local community. We actually, full transparency, built this dashboard with the intent to use it for a grant opportunity that hasn't quite come to fruition yet. But we hope that it's helpful for folks to actually better understand their data, that they can actually pluck from that and maybe use that in a grant application. So we have promoted it alongside the Child Care Capacity Accelerator grant opportunity. It's ready-made to help you tell the story of the health needs in your community, some of the care needs, and some of the education needs of your community. We also hope that it can help you with different conversations in your community. So this could be, again, with local elected officials. It could be, it could even be with your families and say, you know, here's the reason we provide this program or this service, or does this ring true to you? As well as overall understanding of connection points. And what I mean by that is that none of our families come in with single, simple challenges, right? Like we all have different needs that cross sectors, and we want to be able to help you understand what some of those connection points might be. So how does health indicators relate to education? What are the correlations between specific demographics and poverty? We want to be able to put all of that in one place that you can easily see and then easily draw down and tell a robust story. We all might be comfortable with the numbers, but I think a lot of folks learn better from that narrative, from that story, and that's what we hope this dashboard can bring to you. The data that powers the dashboard is publicly available data. There is one data set, I believe, that is something we pull from Child Care Aware, and I will talk about that when we get there. But the rest of it is publicly available data. It's data that already exists and lives out in the ether. And I'll talk a little bit about our partner too, who helps us pull that data down. And it is the latest publicly available data. So everything you see, all the indicators that I will show you, is as updated as that day for that particular indicator. And then you'll also be able to export these different data elements. So sometimes you'll see graphs, sometimes you'll see charts. You'll be able to export any of that information either to a presentation that you're giving. You can export it to a Word document. You can even export it and drop it into an email that you might want to send somebody to share just snippets of the different data that's out there. Next slide. So what is this? I'm going to give you some context, and I recognize it's hard to read notes like this without seeing it. So I'm very glad to walk you through it here in a minute. As I mentioned, it is as live as the data is, as the data itself. So if the data is updated on a daily basis, which very few data sets are updated on a daily basis, it's updated daily. If the data set is updated on an annual basis, that is the latest that's available. So it's ready to share community-specific data on a range of topics. We partnered with a company called My Sidewalk, and I want to call out Maggie Kaufman, who is here from My Sidewalk, to help me in case I stumble through this or misspeak about any of the information. They're a Kansas City based company, lots of connections to the state of Kansas. And they have been doing work around making data storytelling and democratizing data for communities to make change, to give data back to people who can make better decisions and investment decisions. I know they've worked in the childcare space with some of our partners on the eastern side of the state. So they're very familiar with the landscape, and it's been wonderful to work with them. You will see 20 different indicators crossing the health, the education, and the care spectrums. And again, it's publicly available. You'll get to select the geographic boundary of what you want that data to pull from. And you'll actually get to select a couple comparison geographic boundaries as well. And as I mentioned, it's all exportable with the intent to be a narrative to help you convey the importance of the data. I sort of jumped the gun a little bit on this, but key understandings as you're looking at the dashboard and you're running the data story for your community. As I mentioned, it's as updated as the source itself. So there's some data that's only updated every 3 years. That is the latest that we have that's publicly available. So that's the data source there, and everything is noted inside the dashboard, and I'll walk you through where to find that particular information. When you select a geographic boundary, you'll get to select a place, a county, or a census tract, and then you'll have 2 comparison geographies to look at. I'm also going to walk you through what overlays are available, which helps you drill down potentially to understand what geographies you might want to select. After you select your geographic area, you will request the dashboard, and that will come into your email inbox. And again, I'll show you how to navigate that. This is a live URL that you will have. So it's not a static dashboard. It is a live dynamic dashboard. So you can bookmark that URL in your web browser. You can save the email. Anytime you click on that URL, you can be assured that that is the latest data available for those particular indicators for that geographic boundary that you have selected. So it's always live. It's not that you have to go in and rerun it. The URL will be live. Now, of course, you can go in and rerun it, and you can go in and a lot of times it might be helpful to actually do a couple different dashboards and have them all live and bookmarked so you can kind of compare and contrast if you're interested in looking at more of a regional data approach. I'll walk you through this too, but the dashboard itself will have some default comparisons. So if we're looking at something that is a county specific data point, it will also have, if it's available, the state level. So you'll be able to see how that indicator relates to, or how your community is doing on that particular indicator as it relates to the entire state, which is nice to see. You know, is your community doing better when it comes to poverty levels than the statewide average? So you'll be able to see that by default. And there's 4 categories of that the data is divided into, and you can easily jump around within the dashboard. So again, it's the intent is to make this easy for folks to get in, and you don't have to have a high level of data literacy to be able to understand what you're looking at and to be able to jump around and play in the system. This is my lovely drawing with my pen tool that I have. So apologies for the red marks on here. When I get to the site, I'm going to highlight the user guide, which is a separate PDF that you can download and just read and help you understand where the data comes from, and a little bit more of the backdrop that I just explained. I'll walk you through how to select a geography type. I'll talk you through overlays, and then of course you'll go to request dashboard, which will give you the gold. So I think, Julia, that is the extent of these, and I will see if I can get my screen to share and walk you guys through a demo. Are there any questions while I get this up? Okay. And can everybody see the screen here? Okay, thanks, Julia. All right, so this is the allinforkansaskids.org/communities page that I mentioned has all of the data resources. So if you go to this, navigate to this URL, this is the site you will see. You will scroll down, little plug for the Capacity Accelerator grants, as well as the Child Care Community Partnership grants offered by Child Care Aware Kansas. You'll come down here, you'll see several different tools that you can expand upon if you would like, budgeting tools. You'll see how to access surveyor information, how to open a licensed childcare facility. And then here is the information that we will be focusing on today. Research and data, I mentioned the point in time, the Kansas Health Matters, and the KSE Data Center. That's where you would find those links here. If you click on Community Data Dashboard, you will actually come to this page here. Tells you where you are, Kansas Community Data Dashboard, a little bit about why we are doing it, and I'm going to walk you through how it works. Here is the link to the user guide that I had mentioned. You can click on that and it will talk you through how we selected those indicators, maybe some things to think about, maybe some challenges with the data, particularly the data that's not updated as frequently as we might like. And if you're trying to compare data sets, just recognize that not everything is apples to apples in terms of the timeline of the indicator itself. So just kind of keep that in mind. So when I hover over this map here, I can actually, it's focused on Kansas as it should be. I can actually scroll in and I can select geography using the hand select tool. So I can go in and I can select select these. I can select a county. So I can use the hand tool here, or I can go up here to geography type. And this is one of the first choices you'll have to make when you go to select your geographic boundaries and run your dashboard. Are you looking for data around the county? Are you looking for something at a place, which limits a little bit of your options because the place is obviously a much smaller designation, geographic designation, or you can also look at a census tract. Trying to find a census tract at a more local level. There's a census tract right there. So you can kind of see the comparison between the actual county versus the census tract that it lives within. I'm going to actually select county just to give us a broad range. And we're going to do, so once I select a county, I can then click on two more places to select comparison counties. So I want to do Russell County, I'm going to do Ellis, and I'm going to do Rush County. So those are going to be my two comparison counties. You don't have to select comparisons. If you just know exactly that you want to drill down, you can just select the one. The other thing you can do from this page is what's called overlay lists, and overlays will not actually show in the dashboard. This is just about helping you hone in and make that decision about where you want to perhaps make that boundary decision. So the three overlays we have are what's known as qualified census tracts. So you'll see some things pop up, and this is defined by HUD, the Federal Housing and Urban Development. It's low-income housing tax credit qualified census tracts. They must have 50% of households with incomes below 60% of AMI or a poverty rate of 25% or more. Just summarized, it's a HUD designee for low-income areas. I can also select childcare facilities, which might be of interest to many of you. This is information that is from the partners at KDHE Childcare Licensing. So this is you can kind of see the color shading that tells you where there are childcare facilities. Unfortunately, of course, we have many counties that just have, one or two childcare providers operating in that county. So we're looking at Rush County over here. I'm hovering. There's one in this surrounding area, and then there's 5 closer into La Crosse, Kansas. So you can kind of see, and again, this is not about actually seeing the dashboard with this. This is about helping you decide what counties do I want to select. And similarly, when we think about the early childhood impact, where are there children where are there more than 50 children? And so if I scroll out, you can kind of see the general areas where there are high populations. Okay, so I'm going to go ahead and select my counties. I'm going to do Ellis. I'm going to do Rush as a comparison, and we'll just do those 2 counties. So then after I select and I've made my choices, I go to Request Dashboard. And then I'm come here to this form, and this is where we ask you to put in your email address. We ask for your county just to help us understand where the interest lies. Your organization, you'll click Submit. And then you will get an email in your inbox that looks like this. And I just want to make sure this is changing screens for folks. Hopefully it is. Hopefully you're seeing an email. It's going to come from Kansas Community Data. It says your Kansas Community Data dashboard is ready. A little bit of information about what it is, what it includes. You'll have some information about the website and the contact us form, and you'll have your live URL. And again, this is a dynamic link, so you can come back to this at any time. It will continue to be as updated as possible, and you can also bookmark it. So if I click on that, I will actually get to my community data dashboard. So again, it's a URL. I can bookmark the URL. I can share it. I can send the URL to other people, however you want to use it to keep this data fresh. So then we give you a little bit of information about what the dashboard is. There are 4 main categories of the data: greatest need groups, essential family supports, childcare access, and community conditions and context. Again, we initially created this to support an effort that aligned education, health, and care. And so these are the categories that we looked at. I highlighted here, engage with it critically. Some of the information and data may be new to you. Consider how the data changes your perspectives of your community, or how it might change the perspectives of decision makers in your community. This operates just like a website. So when I see these drop downs over here on the side, I could click on any one of these and I can navigate this dashboard as if it was its own micro website. So I can click on greatest need groups. And again, what we really like about this is the storytelling element of it. So it's not just going to give you, we're going to tell you the indicators you're going to see right here. So for this greatest need groups, we're going to focus on the indicators: families living in poverty, households utilizing SNAP benefits, BIPOC population, adults without a high school education, and single parent families. And we leverage kind of research and different information to help identify what these particular indicators to help tell this story. So again, this is the narrative and what we think is the real value out of the dashboard. Education and poverty are closely related. It's for employment. Some of this information you all likely already know. And hopefully it just helps give you some language that you can share out and better contextualize the charts and the graphs that follow it. As I scroll down, I start to see the visualization of the actual data itself. So we selected Ellis County as the geographic region. So it's the first number that pops up here, and it will be the same in other charts as we go through. I will also see neighboring counties. So 9.7% of families in Ellis County are living in poverty. Right below the data set, you will see the source for that particular data set. So if you are big into where the data comes from, you can actually go and Google the US Census Bureau, the ACS 5-year data. So this is updated as of 2021. So you'll just want to keep that in mind. And then, of course, you'll see the Kansas comparison. So in Ellis County, there are more families living in poverty than there are in the state of Kansas. The other thing to note is over here on the side that you can link directly to the item. So let's say you wanted to share this particular chart with a coworker or a colleague. I would click that button. And now I can go up here to the top and I can actually copy that direct URL to this specific chart on the page itself. So it's almost like a jump button that gets you from point A to point B. It's helpful if you are sharing something and you don't want them to have to navigate the whole data dashboard and you don't want to give them the link to the general dashboard. You can give them this specific link to this specific data set or this specific chart that you're seeing. We also have the information conveyed in a different way. So this is all the first indicator, families living in poverty. You have the story here. You have one way to look at the data, and now you have other ways to look at the data. When you have a chart such as this, you can click on any of these, I guess, what are these called? The legend. You can click on any of these pieces in the chart legend to hide the data point, which is helpful perhaps when Kansas as a state skews the data. So I'm going to click off Kansas, and suddenly now I can see there's Ellis, there's Trago, there's Ness, there's the city of Hayes, which is not really showing up as well because it's gray, but you can kind of play around with this and see how the data is presented in a different way. So this is families living in poverty over time. When you see this, you'll also see some dotted lines out to the side. This is kind of a run out. It's a projection. It's a trend line that you can potentially use if it's helpful when you're thinking about future investments. And as I hover over, you will start to see the specific data points that populate and make up that line on the chart. So 2019, there were 671 families living in poverty in Ellis County, which is up from 436 in 2010. So really interesting if you want to look at data over time. You'll also be able to drop down that information in different, this is family poverty by family type. So we have married couples, single family female, single family male, meaning the head of the household is the male. Again, drop down families living in poverty by location. You start to see the full county right here, and I can scroll in and I can kind of drill down to the specifics within the county, which I really like because I think it's really helpful to add the color, particularly when there's one metro, I use that term loosely, a larger urban population within a specific county where most of the county is rural. And sometimes that city or that larger town can skew the data of the whole county. So it's nice to be able to see something like this, and you can, again, hover and see the different data points there. So that's essentially what you're going to be looking at through all of these different data sets. So the next indicator, households utilizing SNAP, you'll be able to read a little bit about context about why that matters. Why do SNAP benefits matter? And what do they actually imply, or what do they say about your community and access to that? So some things will be correlated in the ways that you might expect. Families living in poverty equals high utilization of SNAP. Some might not, which may be an indicator that you have families who are falling through the cracks, perhaps, that they should be accessing some of those benefits and perhaps they're not. So this is a way to look at the indicators together and in a coordinated fashion. So then I'm just going to jump over here and show you the other indicators that we have. So essential family supports. This is around the overall health and well-being of individuals and how that impacts their ability to care for their family. As we think about early childhood and we think about the health of mom, dad, grandpa, grandma, aunt, uncle, whoever the caretaker is in that family, and how the health of that that person impacts the overall family well-being, as well as how does that family have access to things that are sort of more focused on the household and less about the individual person. So the first two really focus on the health and well-being of a caretaker potentially in the home, so adults with poor mental health. And you can see how that information is defined based on when you go down to the data indicator itself. So for example, poor mental health is defined as rating mental health as not good on 14 or more days in the past 30 days based on the CDC Places survey that they do. People without health insurance, which is a really interesting data set for our state in this point in time. And then you have three that are really more focused on sort of population level. So how many housing units exist in your community that don't have a vehicle, which might be expected in maybe Wyandotte County because there is some public transit, although we'd argue it is not meeting all the needs. But in rural areas without a vehicle, that's a really significant challenge. And so again, it helps you understand What does the need look like, and how might I focus efforts on things that maybe don't pop up as a family walking into my organization needing a service. There might be another layer going on within your community. Households without a computer device. This is really important, as we know, with the COVID pandemic, when so many services went to remote or virtual. I know that at the cabinet, we were able to support some of our home visiting families with technology and tools. Obviously, without broadband expansion, it's a little bit of a challenge to have just a computer in your home. This could also be helpful, though, if you're thinking about investing in a community computer lab or something. What will be the uptake on that? And what will be families who need to look for jobs or, want to do, remote schooling? How are you attracting businesses or employees who might be working remote jobs? Do they have the ability to access internet and have a computer in their home? And then, given that we set this up for a specific grant opportunity, we did talk about what is the impact of COVID, particularly on the community. So again, those are the indicators in this particular category, and you'll be able to read a little bit of the narrative. You'll be able to link to it. You'll be able to export this if you'd like it. And then this is, again, similar structure to how you see the data. I will just note, as you're looking through this, you might see things that are like, well, there's no data for this, or I'm missing the county level comparison, or I'm missing the city level comparison. Again, it's based on publicly available data. So if you're not seeing the level that you want, it is highly likely that that data set is not available publicly for that level. So if you're looking for something at the city level, lots of data isn't available at the city level, lots of publicly available data. And so you might want to extrapolate to the census tract to see if that's available, or look at more of the county and then go to some of the maps which help you look more closely at where that variance might be inside the county. So for example, children in households without a computer device, and seeing where that is mostly the case in specific areas. I'll jump to one that I think lots of folks on this call probably are very interested in, which is childcare access. I don't have to tell you the importance of childcare access. You all know this, so you could probably have written this particular piece in your sleep. This is BLS data, children under 6 with all parents in the workforce. So this is sort of indicating to you what the need might be for childcare. Not always, right? There are some situations where maybe grandma is coming over, or there's a neighbor that's watching a child. So it's not always exactly saying this is the demand, but we would anticipate having that it would be nice for, if there are all parents in the home in the workforce, to have some kind of option available to them for childcare. So you're seeing that there are quite a few children younger than 6 with all parents in the workforce. That's what that data set means. And then we start to get into a little bit more nuanced approach to looking at the data related to childcare, which is the desired childcare capacity compared to the demand. And we're seeing here in Ellis County that 56% of the demand is met, which leaves a pretty gaping hole, as many of you are likely experiencing at a local level. This information is this is the only data set in the system, in the dashboard, that is not real time, in the sense that we get this data from Child Care Aware through an agreement with them. We're very grateful that they're able to share what is in their point in time count. So this is coming from their point in time count, and we just happen to pull it over and have it be part of this larger dashboard. So if you're looking specifically to compare this data set with other indicators in the dashboard, you might want to go to Child Care Aware's site and just run the point in time for Ellis County and just make sure that this isn't very far off. Typically, these fluctuation, or these data sets this data point doesn't fluctuate that much, because we're not, setting up lots of new childcare every single month. But as we do, this of course changes, and we would hope that we'd be able to meet 100% of the demand someday. And then there's the childcare cost burden. And this is a calculation from the living wage calculator and small area income and poverty estimates from the Robert Wood Johnson Foundation County Health Rankings. So this is about looking at how much does childcare cost for families related to their other expenses. The US Department of Health and Human Services suggests that childcare is considered affordable when it comprises 7% or less of the household income. That doesn't happen in very many places, and Ellis County is no exception to that. 26% of the average income in Ellis is required for childcare to meet childcare expenses. So this is often more than mortgage, more than education costs, et cetera. So really important that we recognize the burden that families are paying to have childcare and how can we do better about that. And then the final category is a little bit of what I call a catch-all category, and it's really just about broader community context. So it's not necessarily drilling down to, it is family level data, but it's intended to be taken in the context of a community. What's your birth rate in the community, which can tell you is it going up, is it going down? So you'll see some trend lines there. And also, how does that impact where your potential childcare needs are going to be? You know, what is the birth rate trending towards in the next 5 years? And is your community going to be even worse off than they are today by not having enough childcare for those infants and toddlers coming into Kansas? The infant death rate, which is also really, really critical. It's a key indicator to show the health of the community. Are expectant parents able to access services, healthy services to deliver safely? We also know that there are higher infant death rates for BIPOC women, and so that's another thing to consider here. What's your general community unemployment rate? And then we do 2 indicators, children under age 5 and children under age 5 experiencing poverty, that are nice to see side by side. So how many children are there under the age of 5 in your community, and what percentage of those are actually experiencing poverty? So the first sort of, the 2 together tell you the scale of your challenge. Obviously one is the denominator, which helps you understand better what is the scale and what are we talking about here? Are we talking about 5 families, or are we talking about 205 families? High school graduation rate, and also language other than English spoken at home, which is a nice indicator to look at, particularly if you are looking to focus on the quality of your services and thinking about who is accessing and how are they able to access those services. We know that it's not enough necessarily to have a translated version of your outreach materials, but thinking about, is it in the same sort of cultural competency that family might experience that, and is it a welcoming environment for that family? The last thing, and then I will stop sharing, is other resources. So we know there's a lot out there, and we hope that we have compiled this in a way that makes it somewhat easy for you to grab pieces and grab context. If you want more information on what is out there inside of Kansas, we have a lot of really wonderful partners: UMHMF, the Kansas Health Foundation, Kansas Health Institute, of course, KAC, Kansas Information for Communities. Here are some links if you just want to go down a couple different rabbit holes about how do I dive deeper into this information and what it might mean for my community or for the state of Kansas. We would encourage you to bookmark this and come back and check out some of the sister resources across the state that help us tell a better data story, which ultimately we hope leads to better decision-making and better investments in the lives of children and families. So with that, I will stop sharing. We'll take a breath and a beat and see if there are any questions. Or perhaps I've put everybody to sleep, which is fine too. We need rest. It's a hardworking group. So. Well, I will say if you get into this and you have questions about either navigating the dashboard itself or how to use it, would love to have a conversation with you about how to use it and how to kind of share it with others to tell the data story in your community. I'd also take any feedback if you're like, I would love different indicators in something like this, or I like this format and I'd like to see something drilled down. Thank you, Rich. That's really helpful. Definitely premature birth rates by race would be a really nice layer to add to this. So we are taking suggestions as we think about making this useful for you and your community. So if you have ideas or suggestions or ways that we can support you in telling the story of the need and the strengths of your community, please reach out and we'd be happy to have a conversation. So thank you for letting me share, and thank you, Julia.
Thank you so much, Sarah. That was wonderful. I did not fall asleep. Moving on to some professional development opportunities in the next few months. We have some early childhood conferences coming up. If anybody needs a vacation, the NAEYC's National Association for the Education of Young Children is holding their Professional Learning Institute in Portland, Oregon from June 4th through the 7th. They're offering over 200 sessions featuring the latest information and research in our field, and we'll be offering unlimited networking opportunities. You can see the cost there for members and non-members, and that early bird price will be raised on April 22nd. So if anybody is interested, I would purchase that now. And also Camp GWC, formerly Growing with Children, is holding their 2023 Early Childhood Annual Conference. This is the largest early childhood conference in the area. This is June 23rd through the 24th, starting on Friday with just a virtual kickoff, and then followed by the all-day Saturday conference in Wichita. You can also earn up to 7.5 KDHE approved credit hours by registering for this conference and attending. And again, early bird member and non-member prices, and those will go up on May 1st. As well as a list of all of the upcoming conferences within the next couple months. You can follow that link that Clayton will be putting into the chat. Next, Kansas Parents as Teachers Association is continuing with their monthly training series. They are holding free trainings available for teachers and educators. Each month is going to be a different topic related and relevant to early childhood and family issues. On April 20th, there is one on child abuse and neglect with KCSL. On May 4th, this one was rescheduled from February, I believe. We'll have the racial equity awareness and practices. And then May 17th, a substance use disorder with supporting families. So take advantage of these free trainings. Clayton will be dropping the register links in the chat if anybody is interested, but always great to continue learning. As well as some more training opportunities that are always available. We have Casito, our Kansas Child Care Training Opportunities, who offer a variety of trainings and other professional development for early childhood care and education professionals. They also have scholarships available that you can apply for. Again, a link that Clayton will be putting in the chat for you. So explore the Casito website to see what offerings they have that might match your interests or your needs. The Kansas Children's Service League, or KCSL, is now offering several trainings on child abuse prevention, which also can qualify for childcare licensing hours. They're actually having one tonight on child abuse and neglect, recognition, reporting, and supporting. That is from 6:30 to 7:30. And there is also a registration link for that. So if anybody is interested, they are holding that session this evening. We also have Greenbush, who is an educational service center, And they have a wide variety of virtual and in-person trainings, workshops, and continuing education for educators all throughout the state of Kansas. So you can find more out about Greenbush and explore their calendar of events. Another link that Clayton will get into the chat for you, but they have a lot of wonderful things going on as well. Next is the Child Welfare Racial Equality Collaborative. The Kansas Racial Equity Collaborative is a statewide effort to understand the history of racial inequities in child welfare and to define the problem through a shared language and shared understanding so that we all can advocate for racial equity. It brings together the child welfare workforce and mandated reporters to build shared multidisciplinary knowledge and accountability in achieving equitable outcomes for children and families of color who come into contact with the child welfare system. They have a few lectures that are posted on their website right now. Those lectures are understanding the historical context of structural racism and current day implications, how we got here and a better path forward. Addressing racial inequities in child welfare, view from early childhood. Debunking myths around racial inequities in child welfare, and forward movement, shifting from control of to support for Black and Brown families. I feel now more than ever is a great time to educate ourselves on this, as we can never know enough and we can never advocate enough. Next is some community grant opportunities. I'm sure all of you have heard much about the Kansas Child Care Capacity Accelerator. This will support community-based teams, including early childhood providers and champions, employers, and economic development leaders in their efforts to create affordable and accessible childcare seats in their communities. As we see, that's extremely important. The request for proposals is now available, and all applicants are also eligible to apply for the Innovation Community Add-on opportunity. You can find out more about all of these things on the All In for Kansas Kids website, and all applications are due by 5 p.m. on Monday, May 15th, and these are all electronic submissions. Reminders and next steps. Our early childhood recommendations panel meeting is this Friday, April 21st from 9 to 11:30 a.m. Also, we are accepting applications for our panel. So if you are interested in becoming a member, you can apply now through May 5th. Clayton will drop that link in the chat for the application if anybody is interested. Our next early childhood systems building webinar will be on May 17th from 12 to 1 p.m. So if anybody has any topics that they're interested in or you would like to see at our webinars, please let us know. You can email me. My email address is there. Any information you want us to share at the meetings, please get that to us and we can definitely add it in at the next meeting on May 17th. And again, you can sign up for the All In for Kansas Kids weekly e-newsletter at the Kansas Children's Cabinet website. That is all that we have for you today. Thank you again to Sarah for that wonderful overview of our data dashboard and what it provides to us and how we can utilize that. You can stay up to date with us again by signing up for that newsletter. You can follow us on Twitter, and you can also subscribe to our YouTube channel as well. So again, thank you everybody so much, and I hope you have a great rest of your Wednesday.